During this presentation, we will be discussing pregnancy, C-sections, and birthing customs, three major aspects of women's health. We will be focusing on two different countries and how they practice these three different things. Those countries are going to be China and Brazil. Pregnancy, C-section, and birthing customs. All three of these components are very important parts of women's health. These are issues that individually affect women only. However, it can also affect the child living inside of the mother, which now is affecting two people. They all have relation into bringing another life into the world, which is something that cannot and should not be taken lightly. Sometimes we fail to think that this is a problem for women because our country is a little bit more advanced when it comes to technology and the whole birthing experience. When women are thinking about this time in their life and getting pregnant, it should be nothing but happy thoughts. However, that isn't always the case. Sometimes women may experience pregnancy complications during their actual pregnancy, but also during their labor experience. Most women would prefer to have a natural birth or vaginal birth, meaning not a C-section. However, some things can happen to prevent that from happening. Most of the time, these problems are out of the woman's control, which is where the importance of our doctors and technology comes in. Also, all women are different, which means some women may experience no complications, some can experience little, many, and life-threatening complications. These are 7 of the most common pregnancy complications: high blood pressure, morning sickness, preterm labor, miscarriage, stillbirth, preeclampsia, and gestational diabetes. High blood pressure are the arteries carrying blood from the heart to organs are narrowed, which makes it hard to get blood to the placenta. The placenta is what provides nutrients and oxygen to the fetus. Having high blood pressure puts you at greater risk for other complications, like preterm labor and preeclampsia, which are a little bit more serious. If you have high blood pressure before pregnancy, it will be closely monitored throughout the 9 months. Morning sickness. During pregnancy, specifically the first trimester, women may experience nausea or vomiting. Also, women may be very sensitive to certain smells and foods they may eat. This is a very common complication and it is not serious, and many women will experience this at some point during their pregnancy. Preterm labor. When the baby is born before being considered full term, which is before 37 weeks. Infections, a shortened cervix, and previous preterm births can cause preterm labor. Other things like smoking, not getting good prenatal care, using alcohol or drugs, or having multiple babies like twins can also increase your chances of giving birth before full term. Miscarriage, one of the most common complications, which is the loss of the baby before the 20th week. Almost 10% of all pregnancies will end in a miscarriage, most of them being your first pregnancy. Some signs of a miscarriage include severe back pain, brown or red bleeding, weight loss, or serious contractions. Stillbirth, which is similar to a miscarriage. A stillbirth is the loss of the baby after the 20th week, when the baby is a little bit more developed. Most of the time, there is no cause, but there are certain risk factors to cause or make your chances greater. These risk factors include abdominal trauma, pregnancies that are far past your due date, or certain infections like STDs. Preeclampsia. This is one of the most serious complications as it can lead to the death of the baby and the mother. It is a sudden rise of blood pressure causing the body to swell, mostly in the hands, feet, and face. This normally occurs if you are over the age of 35, if this is your first pregnancy, or if you're carrying more than one fetus. Gestational diabetes. Hormonal changes during pregnancy cause the body to not make enough insulin or not use it normally. The glucose will then build up in your blood, causing diabetes. Women who have this have not had diabetes before their pregnancy. If it remains untreated, it increases your odds of having a C-section and other serious complications. These are only some complications that women may experience during pregnancy. Many more can occur. These are some of the most common. A cesarean or C-section requires a surgical procedure to remove the baby by making an incision in the mother's abdomen. Cesarean sections can be planned, but they can also be scheduled as an emergency. A doctor may recommend planning to have a C-section before your due date if you've previously had one before, if you're carrying twins or more, if your baby is in a breech position, which means he or she is feet first, as well as many other reactions. Emergency C-sections can be scary for women. Natural births are preferred by many, but sometimes aren't the safest route for you and the baby. This may be the case if your placenta separates from the uterine wall, if the doctor is concerned for the baby's health because of an abnormal heartbeat, if the umbilical cord slips through the cervix, along with other reasons. C-sections will also take much longer to recover from. You are undergoing surgery, so you must take precautions while recovering. Hospital time is definitely going to be increased by at least 2 days. It also is going to take time to get back into your regular routine, like eating solid foods. They will start with ice and gradually introduce foods again, as well as taking it easy. Keeping your stitches and wound clean is a crucial part of recovery. Women who wanted to have a natural birth but could not may feel depressed since they could not deliver the way they wanted to. They can feel discouraged. They can experience sadness, disappointment, loss of self esteem, guilt, and anger. Birthing customs. Birthing customs include rituals and different things in relation to how they do things when it comes to a woman's pregnancy and birthing experience. For example, here in the United States, we are known to throw baby showers for the expecting mother, but in the other places around the world, they don't celebrate until after the birth of the baby. Although medical care may not be considered a ritual, it can still be considered a custom. Again, here in the United States, we have access to amazing medical care, while other countries are underdeveloped when it comes to the medical and technology field. So for us, it can be considered a custom. Pregnancy, C-sections, and birthing customs in China. Pregnancy in China is handled very carefully. They advise women to take it very easy while being pregnant and do little to no work. Here in the United States, we see pregnant women everywhere. Some of them work, most of them go out and live their lives like normal, but in China, this would not be the case. China offers many different options when it comes to your birthing experience, like private maternity clinics, a public hospital, or staying in the comfort of your own home with the assistance of medical professionals. Similar to here, you have plenty of options, making a nice experience for whatever the mother may choose. However, if you wanted to experience the private maternity clinic, this comes along with a hefty price tag. It is said to feel like a retreat and not a hospital. So, if you can afford it, they say that this is the way to go. The average time in the hospital here in the US, assuming that everything goes well, is 3 days. In China, you should plan to be in the hospital for at least 1 week. As well as that, you are almost always expected to supply everything for your stay. That includes things from bed linen, hygiene products, and even towels. From what we're used to seeing, this seems like a long stay as long as everything goes okay, as well as bringing everything is not something we see here. Also in China, after you've given birth to the baby, they don't provide care. They expect your family to visit, take care of you, and bring your meals. If your health insurance doesn't cover your services, most places in China also require you to pay in all cash for your services. Nearly half of the women in China deliver by C-section. Although numbers are slowly decreasing, it is one of the highest rates of how many C-sections they perform. Nearly 46% of women give birth by C-sections in China. China's high numbers have connection to their former one-child policy, which will be discussed later. Another reason for this high number is due to beliefs of family members and parents requesting to have the birth on a certain day that may be a special day to them or a holiday. Birthing customs in China. In China, there is one major ritual they follow when it comes to pregnancy. When a newlywed couple entering their or his home for the first time, he shall carry her over a pan of burning coals to make sure her labor will be successful. The man will literally walk over burning coal with his bare feet while carrying his wife on his back. This is practiced in other countries around the world, but it's very well known in China. By doing this, it is supposed to ensure easy labor, easy pregnancy, and a successful experience. At the time, the wife can be pregnant, or it can be done for a future pregnancy. Another thing the Chinese follow when it comes to pregnancy is the concept of hot and cold. This comes from ancient beliefs that say maintaining a balance of opposing forces is crucial when it comes to health. Pregnancy is known to disrupt this balance. The Chinese consider pregnancy on a overheated state, so eating hot foods is recommended to be avoided during pregnancy. Unlike here in the US, in China you are expected to remain home and recover for at least 1 month after the birth of the baby. Not only is it practiced in China, but Chinese people all over the world will follow this ritual. Here in the United States, some women decide to return back to work only a few weeks after giving birth. Women will take their children out shopping, walking, or whatever they need to do before the baby is 1 month old. Many more customs are practiced in China and by the Chinese people. These are three of the main things that stand out and are different from what we see here. China's one child policy. China had a former policy that was created to control the population. It was to be said that a family could only have one child, which only lasted a year, and they changed the policy to that if both parents were only children, they could have a second child. You could even be fined for having another child if you didn't have a permit. As said, it was created to control the population because China has the world's largest population. They created it to be a temporary matter, but it wound up lasting much longer than expected and was said to estimate a prevention of about 400 million births. Just in October of 2013, it was changed so that either one of the parents were an only child, they could have a second child. In 2015, it was changed so all families could have two children. China did also have a male gender preference, which presented problems for parents when they found out they were having a girl. Some women even chose to abort female fetuses when they found out. Pregnancy, C-sections, and birthing customs in Brazil. Surprisingly, the amount of unplanned pregnancies in Brazil seemed to be unusually high. On average, only 40% were planned for the time they took place. The women in Brazil are very cautious when it comes to their pregnancies in the way of prenatal care. 95% of the women receive some sort of prenatal care throughout their pregnancy. Pregnant women choose vaginal delivery, also suffer excessive manipulation, remain confined to bed, are prevented from walking or eating, and receive oxytocin to help with some effects. However, these aren't recommended by the World Health Organization. Also, similarly to China, the C-section rates are fairly high. The reasons, however, differ because in Brazil, the main reason is just the fear of the pain. Women start off wanting a vaginal birth but wind up changing their minds during the length of their pregnancies. Teenage pregnancies are also a problem in Brazil. However, they found that when women had more education, the less teen pregnancies there were. So they started doing studies and placing new schools in areas where this was a problem, and the numbers have decreased. Some customs that they follow in Brazil. Pregnant women in Brazil are known to be as princesses. They treat pregnant women with the utmost respect. A pregnant woman in Brazil does not even wait in a line. She will be put to the front so she does not have to wait. Like here in America, we have a baby shower before the baby comes. In Brazil, they have a similar party, but just after the baby is born and is given gifts. Some health problems in Brazil in relation to pregnancy. In the past years, there have been certain outbreaks of dangerous diseases that led to dangerous pregnancies. Some of these outbreaks included malaria and the Zika virus. Malaria is more of a constant problem. There are a high number of cases in the Amazonian region, which causes a fear to get pregnant because it presents great risk for the mother and the baby. If you happen to get malaria during your pregnancy, it must be treated immediately and effectively from the beginning in order to make it work. Just last year, Brazil went through a tragic outbreak of the Zika virus. Women were actually avoiding and being told to avoid pregnancy at all costs because of the virus. Mothers who were infected with Zika present a much greater risk to their unborn child and their chances to have malformations of the brain, hearing deficiencies, and other developmental issues. On top of that, there is no specific known treatment or vaccine to cure the virus. The impacts on women in both of these countries. In China, for the women living in China, over the years, being pregnant in China has definitely gotten better. From changing their policies, they have access to an abundance of facilities to have their baby at, and along with the help of very good medical professionals and their medicines and technologies. For the pregnant woman herself, the way they practice pregnancy can be taken upon the woman, but for the most part, living in China and being pregnant is not too hard. Brazil. Being pregnant in Brazil, for the most part, for the mother is fine when it comes to prenatal care, hospital treatments, and their actual pregnancy. However, pregnancy can be considered a risk since there are a few disease outbreaks that happen frequently. Thank you for watching. Hopefully, this helped you understand how pregnancy, C-sections, and birthing customs are different in other countries. These aspects may be the most important parts of women's health, and we need to make sure we stay on top of new changing technologies and anything we can to maintain the safety of these three parts.